This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
And welcome back, everyone. We're going to talk about something today that affects many, but there's a lot of misinformation out there. And this challenge can be debilitating, game-changing for many. I'm referring to Bell's palsy. What is it? You might have heard of it. What actually causes it? We're going to dig into that today with somebody who helps people with this all the time. And she offers all different types of massage therapy and also acupuncture as a founder of Path to Wellness in Tulsa, Oklahoma. She is Teresa Wilkinson. She's back with us. How you doing today?
I'm doing great. How are you?
Real good, real good.
Good.
This whole Bell's palsy thing, haven't heard a lot about it recently. And I don't know if there's less cases, but you deal with a fair amount in your practice, right?
That's right. So
what is it? Let's go there. What exactly is it?
Okay, so it was originally named and discovered by Dr. Charles Bell, who is a Scottish surgeon in the 19th century. And so it's been around probably for hundreds of years, but it was tagged by him. So therefore it's called Bell's palsy. And when I started nursing back in the late to mid 70s, they actually put people in the hospital for it and gave them muscle relaxers and pain pills. They did not know what to do with it. Now, it's been in the last 10 to 15 years, they have figured out what to do. But what I'm running into is most doctors don't know. And it can be anywhere from a new doctor to a 70-year-old doctor, because I get the patients that tell me their story, and I've had two just this last week, and that's why it came up. But I'll get answers like, it's the first diagnosis with this one lady a year ago was, it's Bell's palsy, but it will go away. Well, then she ended up going to a neurosurgeon, and then she had a CAT scan, and then she went to this doctor, and then she went to that doctor. So they finally diagnosed her with myofascial spasms. So that's what she came to me for. Well, I take one look at her. I said, you have Bell's palsy. Did they give you an antiviral? So now they figured out it is in the same family as herpes, shingles, Epstein-Barr virus. And I even had another client who went through a year bedridden of Epstein-Barr virus. Well, they had given her an antiviral and a lot of times some corticosteroids. They can get over it in a week or two instead of a year and a half. Now, the concern and why I'm so adamant about sharing this is on the internet, and a lot of these doctors will say, oh, you'll get over it. You'll be fine. Well, guess what? They don't get over it. And then it's permanent. And then you have a permanent eye that droops and tears all the time that you're constantly putting eye drops in. It affects your sleep because you can't close your eye. Or one lady that I had, and there really was beyond something I could do, but she ended up getting it when she was born. And they didn't notice because she was a baby. And then as she grew up, they noticed there was something going on there. She came to me in her mid-40s. We did anywhere from 10 to 15 treatments once a week, and there was just no change. So once that locks in, you really can't change it, unless what I saw on the internet was there's a plastic surgeon laughing all the way to the bank, fixing people with plastic surgery. So it affects the seventh cranial nerve that comes out from the ear. It branches down the jaw, so it affects the mouth. It affects the nose, and it comes up and affects the eye and goes up to the eyebrow. Now, the thing is it can actually affect your vision. It can affect your hearing. It can affect, slurred speech, drooling, your sense of smell, your hearing. So it can be something that really affects your life and the quality of your life. So that's why I want people to know, hey, and I've even had people go to a dentist because their mouth is involved, And the dentist will know to give them an antiviral and some steroids. Now, if you do the medication along with coming in and getting some acupuncture, then you can get over it within a year or two. I mean, a week or two. But if you, and I had another man once that had it for a long time before he came to see me, and he went to a dentist and they took all his teeth out, thinking that would cure it.
Oh my gosh.
So, a lot of things happen to people, and I just want people to know, hey, you can, and you can even look online what antiviral it is, but your doctor should know. And if they don't, you can Google it. But there's an antiviral, there's corticosteroids, and then, but different people will have it in different intensities, and some will be very severe, and then some isn't so bad. But when it affects your ability to talk, smile, your eye to open and close, and if your eye stays open all the time, sometimes people have to tape their eyes shut to sleep at night
Oh,
because they can't close their eye. And so, or even just facial expressions, like, you might have, hey, your eyebrow raised with an expression, and now your eyebrow can't raise anymore. So I now have two patients this week, one that's had it for a year and a half, one that's had it for a year, and doctors didn't do anything for it. One was sent all over, like CAT scan, all this stuff, and different experts, and nobody knows what it is. And so I'm thinking it's such a common, simple thing that we should all know, but a lot of doctors aren't aware of it. And that's what's shocking. Now, Oklahoma, according to the news, is ranked the last in the nation for medicine. So it could be that I'm in Oklahoma.
well, thank goodness we have you there. Jeez.
So
Wow.
anyway, I just wanted to bring this to people's attention, because if they have a loved one or if it happens to them, uh, it's that simple. Come and get some acupuncture, get get your prescription, and you can get over this pretty fairly quickly. But to have it permanently, do you realize what a drag that is? To have your eye uh, dripping all the time, or not being able to speak. It's almost kind of like a stroke. So that's
Okay.
another thing.
I wanted to go there. It's got to be very unsettling to know that this thing could just come on out of nowhere. And then you wonder, is this a stroke? It presents what sounds like similar symptoms, right?
It's very similar symptoms. And it's very similar symptoms. So that is an issue. There's a little bit difference in the paralysis. So a TIA is what I'm going to refer to, uh, transient ischemic attack, which is where you have a small occlusion to, say, um, a major blood vessel to a certain part of your body. Sometimes it can even, I had a friend a few years ago that came to me with half her face paralyzed. It started in her tongue. And it wasn't this complete drooping that you see with the Bell's palsy. She had complete function, but she just had numbness. So I was concerned for a stroke there. Turned out to be a brain tumor contained above her ear on the opposite side of the face. So if it was on the left side, it's going to be on the right side of the brain.
Okay.
So I have had people come to me with all of a sudden their eye goes blind and they're in their mid 40s. And I say, well, that's a TIA. You've got some occlusion to your optic nerve for the blood supply to your optic nerve. So I've done an acupuncture, cranial acupuncture to the opposite side of the brain and got the sight back. Same with the ear. I've had people going, I got out of my car, I was just walking down the driveway, and all of a sudden I went deaf in my ear. Again, that's a TIA. I had another patient this last week that all of a sudden she says, I woke up and all of a sudden my right hand is totally paralyzed and I couldn't use it. I went to the doctor and he said it was my neck. I'm telling you, you're not going to go paralyzed in your hand with a kink in your neck from sleeping wrong. That's going to be a TIA. So I get these misdiagnoses all the time. Now, I was able, she had a girls' weekend coming up, and I was able to fix her in one treatment. But I have different techniques I use. So one thing I wanted to go into is the two different electromagnetic things that I will use for treating Bell's palsy.
Before we get to that, I do want to share that this affects everybody. Isaiah Thomas, basketball Hall of Famer, he was diagnosed with it at the end of last year. And Lil Nas X, who's a rapper, crossed over to country, had a big song a couple of years ago, maybe a little bit more than that, called "The Old Town Road." He had it in April, and he thought it was a stroke. I remember him doing posts from his hospital bed, because it kind of freaked out, but it was Bell's palsy. Can this come on out of nowhere?
That's right.
It does. Okay. And I remember a coworker told me that his wife had come down with it. This is going back many years before a lot of this was figured out. I'm talking, this is probably in the 90s.
Right.
And I vividly remember him saying that she fell asleep in the car with her face up against the window, which was cold. And from that point forward, she was diagnosed with Bell's palsy. Does that even sound like that's possible?
Okay, so it is possible. Now, this is the thing, is usually, okay, if you think about herpes, herpes usually comes on if you're stressed.
Mm.
Shingles is the same way. It'll come on when you're stressed out. So stress, of course, and if you're traveling and you've got your head in a weird position and say it's on something really cold, whatever, that could be a stressor. So I think anytime traveling in a car long distances can be a stressor for people because you're in an awkward position, you're staying in the same position for a long time. I know I got shingles when I traveled up and down the coast of California up to Seattle. I started in Seattle and zigzagged back between the mountains and the ocean all the way down. And by the time I got to San Francisco, I ended up with shingles. So it was, I think, the stress of the trip. I was with somebody that was a vegan. I'm a vegetarian, but they were very, very strict with their diet. And if we went into a restaurant, they'd ask all these questions. And if everything wasn't perfect, we couldn't eat. And so I think you're not getting to eat. I got
Hey, there's a great vacation.
So I decided I wasn't going to be that strict, but a lot of times it also comes from it's a zoster virus and it comes from chicken pox. Now, in our DNA, we have chicken pox that carries on from generation to generation. And so we do get the vaccinations when we're a little kid. But that goes back into history in our DNA. So that's why herpes, shingles, Epstein-Barr virus, those kind of things can be in our system, in our DNA, and then we get into a stressor and that activates it. So even some people have said having COVID did it for them. So, of course, our life is stressful on the planet. We can allow it to be stressful. So that's where we always need to take a step back, take a breath, relax,
Sure.
ground out, and not let life get the best of us.
Well, here's more evidence of how stress can severely impact your life. Here's another example. I mean, we know, I've been saying it for decades, stress kills, but here's another more evidence of how bad it can be and why we should try to do our best to minimize it. You talked about some kind of treatment.
Okay. So say I have somebody that's had it a year. I mean, that's serious. I mean, that's very difficult to undo because it's a locked in pattern now. So I have a technique that's called Pashi Pashi. It's Japanese for sparky sparky. Can you hear the spark?
I can't hear it, but it's probably because we're on a Zoom and Zoom
Okay.
filters out everything except the voice.
Okay. Well, after the atom bomb was dropped in Japan, and I think this is a dying art, but I got to work with this man and train with him. It was Dr. Kwai from Japan, and he had lines of patients lined up after the atom bomb for him to take care of. And after World War II, we were coming up with diodes. Is that a familiar term at all?
What's it called?
Diode. It's an
Yeah,
electrical component.
yeah.
It allowed us in our alternator voltage regulator, allowed us to have power steering, power brakes, power windows, air conditioning. It amped up our vehicles to where we have the luxury of all these power things that we didn't have before diodes.
Typically, diodes convert AC to DC,
Yes,
and
and it amps it up. It
mhm, yeah,
recirculates, so it builds up, builds up, builds up, builds up.
they're in every power supply. Many electronic devices use diodes in different terms, in different areas as well. So the diodes are in this device.
Well, what I have is the diodes are actually soldered on this Venetian chain.
Cool.
And then, so then this Venetian chain, I will drape around. And do you remember when you were a kid doing the dot to dot coloring books? You know,
Sure.
it would be an image and it would be dots, and then you with a pen or pencil or crayon would connect the dots.
Yeah, sure.
Well, I put in the acupuncture needles in all the different areas. And then I do a few on the opposite side because energy moves through our body like a pendulum. So I have to balance and do things bilaterally, but I don't do the extent that I do on the affected side. And then I connect those with this chain. I lay the chain on the body, connecting the dots. Then
With connecting in connection with the acupuncture needles. Did I hear that
right,
right?
right, correct. So I put the acupuncture needles in, and I use what I call baby needles. They're actually little tiny needles that I use on babies, so I call them baby needles. And then I have a positive, negative, and a ground on my wires. So I have a three-way cord. The positive, negative will go on the face, and then the ground goes on this activating device, and then this sparks and activates the chain in the diodes, and then that creates a circuit and circulates the energy on those needles. Now that's the most powerful type treatment because every now and then pashi pashi translated as sparky sparky, so sometimes it sparks you. So some people go, oh, oh, oh. Some people, they're just like, oh, good, good, because they can feel it's working. Now, I do have an e-stim machine that sometimes I use electrical stimulation.
Is it that's
And
a tens machine?
it's a TENS machine.
Ah,
So sometimes I'll use a TENS machine because if they can't handle this other one, this one is easy because as I turn up the dial, I'll just say, when do you feel it? And they'll go, uh-huh. And then I
whenever I go
stop.
to a chiropractor, he puts that on my back along with a heating pad and
Right,
turns it up as much as you can stand it. And
right,
you wait, I don't know, like 10 minutes or whatever, and he comes back and does his thing.
right,
Hmm.
right. So that helps relax the muscles. So you can do this with acupuncture. It's just there's these Allen clips on the end
We used to
that,
call them
that
alligator clips
yeah.
because they look like an alligator's mouth.
Yeah, that's right. That's right. Uh, so you clip those on the needle, and then that works the same way. So I try to do as much instead of just plain old acupuncture. I try to amp it up a little bit more to get more effectiveness. Now, my usual treatment, I may not do that. I use moxibustion, which is an herb called mugwort.
Oh,
And I may use it, say they have loss of hearing. I may use a longer needle and use some mugwort along with it. And in that longer, I have to get it away from the hair because I light it on fire. So it has a very earthy smell. Most everybody really loves the smell of it. But I've asked master teachers, what does mugwort do? And they say magic. And so I call it my Harry Potter part of the treatment.
I was waiting for that. Not Hogwart, Mugwort. And from what I understand, it's a very powerful herb. Out of all of them, it's up there. I want to say the top, call it the top 10 strong herbs. It's very, very potent.
It's been used for centuries, and they've made tea out of it or poultices, or it's been used in a lot of different ways throughout time.
Wow.
And so before we ever knew about metal to have needles, acupuncture was heated up with the mugwort. The acupuncture points were heated up with mugwort before we ever found metal, and we used gold and silver back in the day, 100, 2,000 years ago. And they would twirl the gold and silver to create that electromagnetic field with the positive, negative of your own body. Now, of course, needles are disposable, so they're an amalgam.
I'm getting from you that this needs to be done. If you feel symptoms of what could be Bell's palsy, that you need to take care of it ASAP.
That's right.
Yeah.
That's right. Do not wait.
And just like a stroke too, like if I'm not really sure what it is. I mean, maybe it's just Bell's palsy. Pass go. Like it's time to, address that immediately, because how do you know? Maybe it was a mini stroke. Who knows? But either way, it needs to be addressed immediately.
Right, because they have clot busters for strokes. And if you get to the emergency room, if you get to the hospital within the first 24 hours, they have a medication called, for lack of better terms, a clot buster that will dissolve the clot fast to keep from any damage to be permanent.
What insight you provided today, Teresa. You always do, but this is, I've learned a lot here today. A lot of the misconceptions, we threw them out the window when it comes to Bell's palsy. This is just a piece of what you do to help people. And I love the fact that you're sometimes unconventional with the diodes. You're in my wheelhouse, because everything I'm a geek. I build things. I've made things. If I showed you half the stuff in this studio, it's fantastic. I'll tell you, just side note, I have a little box that I needed to control the audio using a phone connection, and it's a pill box, and it's got diodes in it and other components to get the job done. Soldering iron comes out, we make it. So I see that thing over there with the chain of diodes. I'm like, wow, really cool. All right, with the alligator place. Mugwort, whatever it takes to make somebody feel better and certainly move past Bell's palsy. You've got a wonderful practice in Tulsa. What's the website?
It's TulsaPath, PATH.com, or you can find us at the Path to Wellness.com, Tulsa, because there's Path to Wellnesses in other places. So Path to Wellness, Tulsa.
So wonderful talking with you today. Yeah. Thank you for all this insight. Truly appreciate it. Really do. We're cool and also insightful at the same time. And this could affect anybody, any of us at any time. So be aware. Celebrities, and they stepped up to let us all know, as you're doing today as well. So thank you so much for being here.
Okay, I enjoyed it. Thank you for letting me share.
Appreciate it.
Okay.
This is the Global Podcast Network, where executives and This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.